Thanks for joining us for the Family Planning Only Non-Citizen Application webinar. My name is Christine Kanata, and I am the HCA Family Planning Program Manager. Joining me is Melissa Rivera, the HCA Medicaid Eligibility Policy Manager. We also have a navigator and some provider admins joining us, our partners. We have Leo Gaeta from Columbia Basin Health Association, Lily Navarrete from Planned Parenthood of Greater Washington and North Idaho, and Samantha Maricias Rodriguez from CMAR Community Health Center. So we'll go ahead and get started. Just one thing. Before we do get started, feel free to type in your questions in the question box, and throughout the webinar you'll be able to do that, and then we'll go ahead and answer your questions at the end of the webinar. Thank you. So the objectives of today's webinar is that we'll provide an overview of the family planning only population programs and benefits. We'll review the step-by-step process for an applicant to complete the family planning only non-citizen state-funded application. We will review the non-citizen application cover sheet frequently asked questions. We'll discuss provider navigator best practices and strategies to guide clients with family planning only non-citizen application scenarios. And then we'll address any questions or concerns. So our family planning only program for non-citizens is a state-funded program, which is only funded by Washington state dollars, so there's no federal match. Our other family planning only program is a federal match, so that's the difference with that. This program for the non-citizens is for individuals who do not meet citizenship or immigration status requirements. And there are a couple links below here that will help you determine that either the applicant or the navigator can assist the applicant in determining their status. We have the guide on the first link, and then we also have a flow chart on the second link. And then the program is also available for qualified individuals who have not met the 5-year immigration bar. Moving on to the next slide. Benefits offered to family planning only clients include a comprehensive family planning preventive visit, counseling, education, initiation, and management of contraceptive methods, cervical cancer screening, sexually transmitted disease and sexually transmitted infection testing, prescription and non-prescription contraceptives, and sterilization procedures. For an example, for men, vasectomies are covered, and for women, an example of sterilization procedure that's covered is tubal ligation. And this is just a reminder, so these benefits are available for all family planning only clients. There's no difference in benefits for the different family planning only programs. So just to briefly go over the application process, the applicant should fill out as much information they can provide to ensure that the application will be processed promptly. Applications are processed within 45 days. However, the current turnaround time is 10 days. The healthcare authority will contact the applicant if more information is needed, and HCA will either send an approval or denial, a physical letter, to the applicant. Just to share with you the non-citizen application timeline. On February 12th, we actually communicated the new application electronically via email through our GovDelivery, and we posted it is now available on our website for use. On the 17th, February 17th, 19th, and today's the last family planning non-citizen application webinar. And by March 1st, 2021, we will post the application webinar recording, the slide deck, and the Q&A on our website. And we will also send all of this information to all our webinar participants. So you'll have the slide deck, the link to the application, and all of the information discussed today. Okay, now we're going to review the actual non-citizen application. Melissa Rivera.
Hi there, thank you so much. So we're going to review the application for family planning only services for non-citizens. This application, we tried to match it as much as we could with the regular application for family planning only services for the citizens. So we try to not make it a huge difference. So I will go over the difference between this application and then the application for family planning only. And as you can see on the slide, we have the links to both applications that you can have handy. And like Christina said, they're available on our SharePoint or on our webpage for you to use them. So the part where it says Social Security number, on the application for citizens, that's all it says is just Social Security number. But for the application for family planning only services for non-citizens, we added the text in parentheses if you have one, and that's because we know that if the individual you're assisting filling out this application, or the individual themselves is filling out this application, if they do not have a Social Security number, it's fine. They don't have to have it on there. However, we do know that there are some individuals who, although they're not a citizen, they may have a Social Security number assigned to them. And so we wanted to make sure that we added that text so that if they don't have one, that's fine. However, if they do have a Social Security number, we would like them to enter that information there on that field, only because it would help us match their identity to make sure, we know it's the correct person. The other part that is a little different from the application for citizens is the in the middle of the section where it has the box where it says, do you have private health insurance or Apple Health Medicaid coverage? So for the application for the citizens, it's a little bit more wordy in there, and that's only because there's the portion about if you've applied for, if you had already applied for full scope Medicaid, you can skip certain sections. Well, we know for the non-citizens that doesn't apply to them, so we removed that language just so as not to confuse them. And so all we need to know is if they have health insurance or not. And if the person does choose to change their mind and they want to apply for full scope Medicaid, we did add the link there so that they have information on if they do decide to apply for full scope. That's the link, and then the box where it says I choose to apply for family planning only coverage is also a check mark that we put on here, because as you know, in November the policy was changed where prior to applying for family planning only, you had to apply for full scope Medicaid in order for us to consider family planning only services. And if you didn't do that, you got denied. Well, that's no longer the case. You can now make an informed choice and decide, I don't want to apply for full scope Medicaid and I want to apply for family planning only services. That's fine. You will not get denied. And we'll go over the definition of full scope Medicaid when we go over the cover sheet. So let's go to the next slide, please. So here on page 2 of the application, if you compare this with the application for citizens, there was a section just alone on citizenship and immigration status. We removed that because now that we created the second application for the non-citizens, we don't need to know whether or not you're a citizen, and we don't need your immigration information. So we decided to take that out, and so now all we need is information regarding income and deductions. So just for these sections here, we just need to make sure that the person that's applying for the coverage, that they check the boxes that only apply to them or their households. So they just need to write in the amount that they earn on a month-to-month basis before taxes. If someone other than the applicant, for example, a spouse, is receiving the money or deduction, then all we need to do is just write their name on the line where it says who receives this. And then if the applicant is receiving, if the person that's applying for this coverage is just themselves that's earning this income or has these deductions, all they need to do is write self. If the applicant is a teenager or a victim of domestic violence, and they are applying for confidential services, they only need to include income that they receive. So we wouldn't need to include the income of the other household members that claim them as a tax dependent. So let's go to the next page. So here on sections 5 to 7, we still need you to make sure that you fill out section 5 whether or not you file taxes. So this is really important because without this information, then staff would have to try and reach you. So if you file taxes, or if you don't, a non-tax filer, just make sure that that section is filled out. Also, some of our data sources that we receive is usually not up to date. So number 6, where it says recent job loss, if you recently had a job change or you stopped working, and it's been with a matter of weeks or a couple of months, we need you to make sure to put that on there because that's helpful for us because we might have different information, and this would also help us process your application faster. Sections 8 through 10, if you are assisting the individual apply for this program, we just need to make sure that they read the bullets below number 8. We have had some people express concern under the second bullet where it says my information may be reviewed by other state or federal agencies. And we let this information on here because we do that. But I also wanted to explain state or federal agencies does not mean immigration. State means other state agencies, for example, using the Social Security number, we are able to cross-match information that from employment security that would tell us whether or not you're working or getting unemployment. So that's why we put the state on here, or as well as DSHS. For federal agencies, also using your Social Security number, we can verify if you are getting any type of Social Security income. And so the Social Security Administration is a federal agency. So we wanted to be transparent and let you know that we do that, but it does not mean it's immigration services. If you are interested in having an authorized representative represent you, make sure you fill out section 9. If you are not sure what the role is of the AREP, we have that definition also on the cover sheet that we'll go over. And we need to make sure that this is something that the client is asking. If you are assisting the individual, you can't just say I'm going to be an AREP. The client actually has to say I want you to represent me. And so just put your information down, and then we just need the signature of the applicant. And then there are several ways to submit the application, either by mail, fax, you can call in, or email the application. And I think that covers it.
Thanks, Melissa. So moving on to the frequently asked questions. So this is page 1 of the application for non-citizens cover sheet. What I'm going to do is review a few questions and answers. I'm not going to go through the whole document. We're just going to point out a few Q&As, and then it'll be up to you to read the rest. So the first question is, are you eligible for family planning only services for non-citizens program state funded? The FPO services for non-citizens program state funded is for individuals who do not meet citizenship or immigration status requirements, or for qualified individuals who have not met the 5-year immigration bar. FPO programs are available to Washington residents with income at or below 260% of the federal poverty level, regardless of gender and immigration status, who are not eligible for full scope Apple Health programs and do not have other health coverage. FPO programs are also available to insured individuals who are seeking confidential family planning services. You can apply for family planning only programs at any time. The next question I'll review is, are you considered a Washington State resident? You are a Washington State resident if you currently live and intend to reside in Washington, enter the state looking for a job, or enter the state with a job commitment. So if there is an applicant or potential client that is a migrant worker and is only going to be temporarily residing in Washington with a temporary job, that person would not be considered a Washington State resident. That's just an example. Moving on to page 2, I will review how will HCA use your immigration status information. HCA uses this information to determine your eligibility by confirming your identity, citizenship, immigration status, date of birth, and availability for other health coverage. HCA does not share your information with any immigration agency for immigration enforcement purposes. Eligibility for the FPO services for non-citizen programs state-funded is exempt from the public charge test. If you have questions or concerns about how an application for Apple Health or the FPO services for non-citizens programs state-funded may impact your immigration status or chances of becoming a permanent resident or citizen, contact an immigration attorney. So the next line we actually do have to delete. We noticed the sentence is, if you do not have an immigration document number, leave these items blank. So as Melissa mentioned, we don't have a citizen or immigration status section on the non-citizen application, so you don't have to worry about that. The next question I'll review is, are there language or disability services available when applying? To get free help in another language, including an interpreter or translation of printed materials or a disability accommodation, call 800-562-3022. And you can also learn more at hca.wa.gov/interpreter-services. I'll also review the AREP. As Melissa mentioned it's on the last page of the application. Can you use an authorized representative AREP to apply? Yes, an AREP is any adult who is sufficiently aware of the household circumstances and is authorized by the household to act on behalf of the household for eligibility purposes. This is different from partnering with a navigator or broker. Okay, moving on to page 3. I will review what is full scope Apple Health Medicaid and should you waive your right to apply for it. If you are eligible for full scope Apple Health, you can access benefits such as inpatient and outpatient hospital, home health, physician services, prescription drugs, dental services, and physical therapy. We encourage you to apply for full scope Apple Health coverage in order to receive the maximum health benefits you may be eligible for. For more information on full scope Apple Health, visit hca.wa.gov/apple-health. You can waive your right to apply for full scope Apple Health if you are not eligible and still receive FPO services. And the other, I think that's all I'll review for the FAQ on page 3. So if there's any questions on that, please add it to the question box, and then we're going to move forward. That's all for the FAQs. Now we're going to have a few of our partners join us, and I'm going to have them introduce ourselves. We're going to review and discuss some provider navigator best practices and strategies to guide clients with family planning only non-citizen application. So the purpose of this is that basically now that we have 2 applications, it may be a challenge to assist clients and to decide which program is best for them. So we've reached out to a few of our partner provider admins and navigators, and they're going to go through these questions and provide their best practices and strategies and recommendations on how to go about doing this. And I'm going to go ahead and have them introduce themselves. Leo, are you available?
Yes. My name is Leo Gaeta, and I'm Director of Programs with Columbia Basin Health Association. We have clinics in Othello, in Mattawa, and Connell, Washington. So it's southeastern Washington.
Thanks, Leo. Lily?
Hi everyone, my name is Lili Navarrete and I am the Director of Public Affairs and Raiz at Planned Parenthood of Greater Washington and North Idaho. We have 11 health centers located in Central Washington, Spokane, and the Panhandle area.
Thanks, Lily. Samantha?
Hi, my name is Samantha and I'm a navigator at Seymour Community Health Centers.
Thanks, Samantha. Okay, let's get started. The first question is for Leo. Are you currently assisting clients to apply for both the federal family planning only programs and the non-citizen state-funded family planning only program? How have you navigated with clients which program they should apply for?
Well, the answer is yes. As a community health center, our role is to provide families that come to our clinics to access to different programs. So based on their needs, we match them to the program that's available for them. So for family planning only, typically families come in the door in different ways. Some may come in and schedule an appointment for family planning. Some will identify back when they're at the medical consultation with a doctor because of the confidentiality behind it. So typically when a family is identified in need of family services, one of our community health workers, health educators, or patient services representative will meet with the individual and explain to them the different programs that are available and help them with the application process.
Thanks, Leo. And this is to the attendees. Do you have any questions or comments for us for question number 1? And I'll get to the other questions after this slide. Okay, moving on. This question is for Samantha. What are some recommendations you have on how to promote client privacy, respect, and informed decision-making around this process?
So what I've noticed is, as a whole, customer service is a pretty big thing. Just making them feel welcomed and heard. People tend to be more comfortable explaining their situations when they feel like they're in a safe space. Also, like welcoming and inclusive signage around either your office or your desk space could also make people feel good to see, as well as having things like in different languages. Also, letting clients know we don't give information to immigration services is a big thing, especially with the population that I tend to work with. A lot of people are concerned about that. And then also just kind of answering their questions and just make them feel like we're not trying to like be sneaky or anything like that with the information that they're giving us.
Thanks, Samantha. Thanks for your recommendations. Are there any comments or questions about question number 2? Okay, moving on to question number 3, and this is for Lily. What are the primary questions or concerns you have heard from clients around this application process?
The main concern that we've heard is if this assistance is going to go against their immigration status or if it's a public charge type of application. And the other concern or question is if their information will be shared with any federal entities like Homeland Security. Those are the 2 main ones that we have to explain and educate on.
Thanks, Lily. Any questions or comments for question number 3? All right. So I just wanted to open the floor to Leo, Lily, or Samantha, or anyone from our team regarding this slide and any comments they'd like to make.
One of the things that I wanted to add in regards to family planning, family planning is a concept that's a real personal, as one of the other guests commented on, and many families don't understand the entire concept of the benefits that are provided by family planning only, such as the vasectomy, tubal ligation, sexually transmitted STI testing, and those kinds of things. And so oftentimes health educators or other individuals in the healthcare setting may be the gateway to introduce some of these aspects of these programs. So the idea is that they may have more trust or confidence with that staff member. And so the idea is to help other staff understand the concept of this program or the services that are covered so that it can get promoted really well, because our concern is that sometimes it comes in after the fact when the family has a bill that these things come to surface that they may have been eligible for services from family planning only programs.
Thanks, Leo. That's a good point. And yeah, we often, we do also get questions like, is family planning only available for men or other individuals? And that answer is yes. And I think most times staff may think that it's just that this program and the services are only available for women. So we want to point that out. And I appreciate your feedback, Leo. Anything else before moving on to the questions? I'm getting some questions. Okay, I just wanted to I want to thank Leo, Lily, and Samantha for their time and their expertise on their strategies to helping clients with the family planning only applications. And we'll go ahead and move on to questions. All right, so our first question here is, why does the app for family planning only for citizens have the clause in Section 9 saying, my information may be reviewed by other state or federal agencies? This information will not be shared with U.S. Customs and Immigration Services. However, in the non-citizen app, the second statement is not there. I'm going to go ahead and, this is just, let's see. Melissa, chime in if you have something else, but we actually removed that because we didn't want the applicant to be swayed away from applying for or through the non-citizen application. We don't want to make it too technical, which is why we removed that information. But we are, Melissa did review or remind everybody, and that we will not be sharing that information with immigration agencies, federal immigration agencies. Melissa, do you have anything to add?
I want to add also that when it comes time to review the application for the citizens, we may change the language on that as well. The difference between the application for citizens and the application for non-citizens is anytime we make changes for the application for citizens, we have to get it reviewed through CMS, who provides us the federal funding. And so with the new administration, we're not sure what's going to happen. And so it'll be changed. I just can't tell you what it's going to be changed to, just depending on the changes to come with the new administration, and then as well as having it reviewed with CMS. So hopefully that kind of clarifies that.
Thanks, Melissa. The next question, where can they get a family planning only application besides online? Usually providers and navigators, I believe, have printed applications. You could also call us, call HCA, and we can mail one to you. Am I missing anything, team?
I think you have it covered.
All right. Next question. Is there an FPL chart for 2021 for this program yet? I believe the charts come out in April, so I know that we haven't updated the chart on our website, but I will double check. And usually the current chart that we have, we make sure that the FPL charts are current. You can access that on our website, hca.com, and it's on the family planning only page, so you can search that page. And I can also send that to you, Abigail, once I review all the questions, and I can send that to you via email. Next question. Do you have to have family planning only application approved prior to having a family planning only procedure? I'm going to go ahead and answer that, and then I'll have the rest of our team chime in. It's preferred that the applicant complete the family planning only application and get approved before having a procedure or taking advantage of the benefits, just for the provider's convenience, so that it can be billed and paid on time. However, I think there are circumstances where an application, you could still, it could be, I'm not sure if we don't do back pay on that. So help me out, team.
There's retroactive eligibility. This is Melissa.
There you go. Sorry.
Yeah, there's retroactive eligibility for Apple Health programs, but not for family planning only. So it's best to make sure the person is approved for family planning only before providing the services, because it's not retroactive.
Thanks, Melissa. Okay, next question. Do you have a family planning only application in Spanish? Yes, we do. On their website, we do have the application available in 15 other languages, and Spanish is included. And the link to our application is in the slide deck, and it'll also be sent out to all webinar attendees. And it was sent out to all Apple Health providers on our distribution list on February 12th. Okay, so the next question is, so are we using two separate family planning only applications? So yes, so this application that we reviewed today is the application for non-citizens, and then we also have a regular family planning only application, and that's for the federal funded program. So yes, there are two applications available. STI testing is covered as part of the annual exam, correct? For men as well, yes?
Do you want me to answer? This is Melissa Kundor. Okay,
Thanks.
so in the family planning only programs, STI screening, testing, and treatment are only covered when they are medically necessary for the client's safe and effective use of their chosen contraception. So that would be very dependent on how the provider documented. Also, when you're billing for STI testing, if it is part of using a birth control method, when you bill that to the healthcare authority, there always has to be a primary diagnosis of family planning, or it'll automatically get denied in provider one, because family planning only services in that benefit package require the primary diagnosis of family planning. So if you stick STI, one of those diagnoses codes as a primary, it'll automatically get denied no matter what services were provided.
Thanks, Melissa.
Mm-hmm.
Okay, let's see, I got lost, just a second. Please show the slide showing the benefit services covered by family planning only. Sure. Let me just go back. To that. Okay, I'll leave that up while we answer the next question. Is it considered a public charge? No. So we actually answered the question in our FAQ. The family planning only program is not considered a public charge. And I'll get to that as soon as I leave up the benefits slide for a brief review. Can family planning only clients apply for retroactive coverage? The answer is no. Our family planning only program does not have retroactive coverage. The next question is, how can we process a confidential family planning only application, and what is the age to apply? Melissa Rivera, are you able to help me with that, with how they can process a confidential application?
I think there's just a spot on the application, right?
Yeah, let me go.
I don't have it. Yeah, because in the they can seek family planning, or they can seek confidential
Regular Apple Health? Oh, I'm sorry.
Yeah, they can request or seek confidential family planning services if they are, you know, the 18 years or younger. There's they just have to mark the box or write it probably on the application, and then the staff would be able to see that and then process it so that it's confidential. So you know, it's a good question too, because if for example you're a teenager and the address, you don't want mail to get to a certain address, you just need to make sure that where it says address where you live, if it's different, if you don't want mail to go there, then, you know, put your mailing address to where you want the mail to go to if you're seeking confidential services. And then also, you know, the question where it says, can we contact you, the phone number, that's important that you also answer yes or no, because we don't know if it's you have your own cell number or you don't, and you don't want whoever answering to know about that. So if you're helping the individual, you know, fill out the form, just make sure those parts are filled out. And then again, about the, you can have somebody become an authorized representative for you also, so that if you prefer that they get contacted or get mail, there's also that option.
Thanks, Melissa. Sorry about that. Okay, the next question is, is the program good for 12 months? Yes, the family planning only benefits are available once approved for 12 months. Okay, we have a comment/question. During outreach for our clinics, our staff often says things like, we won't ask immigration status. However, if they end up getting enrolled in the family planning only program, citizen or non-citizen, they will indeed end up needing to share their immigration status at some point. I see that your talking points include a note about how their information isn't shared. However, is it okay to also tell clients that we ask in order to determine which pool of funding they'll need to apply for? Federal funding for federal funding for citizens and state funding for non-citizens. So the question is it okay to also tell clients that we ask in order to determine which pool of funding they'll need to apply for? I would say yes. Then you can reassure them that when they'll know where it's funded, which is why we included state funded in our wording. And yeah, it's just good to inform the applicant, to give them as much information as possible. Anything from our team? Anyone from our team that would like to add? Okay, and then Carrie, just let me know if I answered your question. Moving on, can we get the FPL income table for this program? So our team did share the link with me, and I will send that out, but it is on our website. And I will send it out directly to you, Raquel, and the other attendee that asked that question. Next question, how long does it take family planning only application to be processed? So usually it takes about 45 days. However, our current turnaround is 10 days, and it may be sooner. I think the quickest way is to call in your application to our HCA staff, and that is the quickest way to get it approved. And we encourage the applicant to have all their information and fill out the application as much as possible so that the application can be processed timely. Will the income guidelines be the same for family planning program for the non-citizen program? Yes, it is the same for all family planning only programs. 260% at or below the federal poverty level. Excuse me. Is it secure to email the application? As long as you send a secure, there is a process to send a secure application to us, and we ask that you do that when you do email it to HCA. Okay, the next, I have a comment here. You said 18 and under, some applicants are older. I'm thinking, Abigail, are you referring to confidential clients? And yes, there are, okay, and you said yes. Yeah, so that there are confidential clients that are older as well. That they could be domestic violence victims, but we also point out that teens 18 and younger are also eligible for confidential services. So yes, other confidential applicants are older and they can be domestic violence victims. Are over-the-counter condoms covered by the family planning non-citizen program? Melissa Condor, are you able to confirm that?
Yes, over-the-counter contraception like spermicides and condoms are covered without a prescription, and that's at a family planning clinic or the pharmacy under family planning only, no matter which benefit package, of whether it's citizen or non-citizen.
Thanks, Melissa.
Mm-hmm.
Is it possible to add a confidential checkbox and mailing address, not an address where you live, to protect clients seeking confidential applications? Yes, I was slow to answering that because I know that we do have that option, and Melissa Rivera, correct me if I'm wrong, on our other application, the general family planning only application. But we will take that, and once we release, or once this we're looking back to see how this goes, and we will tweak the application with suggestions made by our partners. Anyone like to add anything?
Yeah, this is Melissa Rivera, and yeah, every year we do review all the applications that that we have, and so any suggestions we take, or if there's policy changes, we definitely will look at changing it. So this is a suggestion we will definitely look at and change it.
Thanks, Melissa. And I'm sending out, I hope everyone can see it, the link to the federal poverty level standards on our website. Okay, and we got a next question coming in. Is the same timing process 45 days to respond to client if eligible, if it is mailed, faxed, or emailed? Usually 45 days is the max for our application approval process, but it will vary if whichever mode that the application is submitted. So it does depend on the mode, but we usually, for all modes, our current turnaround time is 10 days. Okay, what is the website? I'm referring to the HCA website, so you could just go to hca.wa.gov and you'll be able to find all of the information on family planning only. And you can also, let me move back to the last slide. You can also email us at familyplanning@hca.wa.gov, and I will respond to you as soon as possible. If there's still time before you get to upload it, it would be great. If I may suggest to change the address where you live to mailing address, that should take care of both regular and confidential applications. Thanks, Abigail. I appreciate it. Okay. Any other questions? We still have some time before I have about 12 minutes and we're open for questions. Any comments from our team? So as I mentioned before, we will have all this information going out, so you'll have the slide deck available for you to share with your colleagues. We'll have the Q&A from all of the webinars that we've held, the question and answer, and then we will also have a recording. So if anyone missed it, you can also share it with your colleagues. I have another question here. I contact a local HCA rep. Can I send the application to her? Actually, we ask that you send the application to the email provided on the application itself, just to make sure that it gets to the right person. So apple@hca.wa.gov. You can copy your HCA rep. Maybe she'll be able to help you, or she'll be able to follow up for you as well. But I recommend to send it to the general apple@hca.wa.gov email address here that's found on the application. Any other questions or comments from our staff or partners?
Christina, I just want to comment that I appreciate the work the HCA team has done to streamline this application to make it more user-friendly for non-citizen applicants. In the past, I know some of the feedback from our CHWs and our patient services reps was that once immigration questions got started, were asked, families just stepped back and didn't want to proceed with the application. So thank you for addressing those concerns in this application.
Thanks, Leo. And it was a combined effort with some of our partners and advocates. So we appreciate those that have been giving us, providing feedback, and we appreciate your partnership, and also to the HCA team for working on this. It's been a few months or almost a year, but we finally got it out. So we're glad this will be helpful to provide more access to the program. Let's see. I got a few questions or comments. The email address you said is secure. So the apple@hca.wa.gov. Yes, that is a secure email. So we are able to, it is a secure email to send confidential or private information. So don't worry about that. So I'm just going to read a few comments. I'm really happy that this is more readily available to non-citizens. Clients have been very open to it, and it's greatly needed. Thank you. I feel like I can really help more. Thank you. Thanks, Abigail, for the comment. This is a great overview of family planning only non-citizens. This is my second time, and I've learned even more. Thank you, Misan, for your comment. Thank you, Leo, Samantha, Lily, for your on-the-ground view of the program. Yes, thank you again. That's a good point. We wanted to make sure that we had actual navigators participate in this webinar because they're the ones on the ground and they know what's going on, so appreciate it. And then we have a question, when did this non-citizen program start? So the non-citizen program did start last year, January of 2020. And, we're still working on ways to improve the program. And thank you for everybody's comments. We still have about 8 minutes, so I'll still leave the floor open. Okay, I don't see any comments in the comment box, so I'll just leave it at the last slide for one last time. Oh, I got something to come in. To recap, add a confidential box and change to mailing address. Yes, we will take that recommendation. Thank you, Abigail. Okay, so thank you everybody for your time. On behalf of HCA and our partners and navigators, we appreciate you joining the webinar and have a great rest of the day. Thank you.